Hi, everyone. My name is Ilona Overstrud. I'm the Vice President of Community Outreach for SmileChild. SmileChild is a Columbus nonprofit that empowers caregivers by providing comprehensive education and resource connections to ensure that every baby has a chance to smile. We're fighting infant mortality using multiple approaches, including an incentive-driven module-based smartphone application and community events. In order to make key information more accessible, SmileChild is also partnering with moms-to-be and researchers at Nationwide Children's Hospital to implement an educational app focusing on topics such as smoking and safe sleep practices for infants. We also host community events to increase general knowledge and awareness of infant mortality in Central Ohio. And with these strategies, SmileChild is aiming to bridge the gaps in education and help end preventable infant death. So today we're hosting a panel to discuss some topics relevant to infant mortality as well as smoking. We are joined by a diverse group of experts from the Tobacco Free Collaborative. If everyone wants to introduce themselves, talk a little bit about their roles.
So hi, everybody. I'm Elizabeth DeLuca Concho. I'm the Smoke Free Initiatives Program Manager at Columbus Public Health, and I have been doing this work for about 4 years.
Hi, I'm Amber Jones. I'm the Senior Manager here at Celebrate One. I have the honor and the privilege of supporting our community health workers who are the boots to the community. They are the heartbeat of our organization, serving our moms and getting them connected to essential resources. I've been in this role for about 4 years now. 4 years with Celebrate One. I'm new to this position.
Hi, I'm Heather Pennington. I'm the Tobacco Use Prevention and Cessation Coordinator for Franklin County Public Health, and we serve all of Franklin County outside of the city of Columbus and Worthington. I'm going on 2 years in my role, and happy to be here today.
It's great meeting you all. We can go ahead and get started with the questions. So it looks like our first question, just about the background of the Tobacco Free Collaborative, if you can just tell us about the mission of it and kind of what inspired that mission.
Yeah, absolutely. Thanks so much for asking, Ilona. You know, we started the Tobacco Free Collaborative a number of years ago. No one knows exactly how many years ago it was. And Amber was the first person who started the Tobacco Free Collaborative. So thank you, Amber, for being here. And I hope you'll talk a little bit more about it later on. But the mission of the Tobacco Free Collaborative, which we call the TFC, is to reduce the prevalence of death and disease associated with tobacco use. And we do that by addressing policy, systems, and environmental factors within the city of Columbus and Franklin County. Basically, what we're trying to do, a couple of different initiatives, is we try to prevent secondhand smoke exposure. So try to prevent youth, families, everyone from being exposed to secondhand smoke. We also try to promote quitting attempts. So we try to get people to quit smoking. We want to reduce health disparities, knowing that certain populations within the city, especially racial and ethnic minorities, are exposed to secondhand smoke and tobacco use more than others. And we want to prevent that exposure, as well as prevent youth from starting to use tobacco.
That's awesome. Those are all great initiatives to have. Can you talk a little bit about like the long-term goals for the Tobacco Free Collaborative?
Yeah, so the long-term goals of the Tobacco Free Collaborative are reducing exposure to second and third-hand smoke, promoting tobacco cessation, and then preventing youth tobacco use.
Okay, perfect. Just going into a different direction, kind of towards policy. Could you discuss the different important policies that have resulted from the collaborative?
Yeah, absolutely. So Heather and I are kind of going back and forth with these questions because we are the co-chairs of the Tobacco Free Collaborative currently. So when we're talking about secondhand smoke policies that Columbus Public Health has passed, we have a number of different policies. Some of them are at work sites, some of them are at public places, some of them are housing properties. Just between when Amber was working in this position and now, we have passed 87 secondhand smoke prevention housing properties. So that's 87 different policies that are protecting people where they live from being exposed to secondhand smoke. In addition, just last year, we passed a policy with the Columbus Regional Airport Authority that impacts more than 8 million people every single year. So we've passed policies to protect people where they're living, where they're working, where they're playing, where they're traveling, and preventing people from being exposed to those dangerous impacts of secondhand smoke.
That's awesome. It's great to see the impact that you were able to have in the community.
Yeah, great job, Elizabeth, and Columbus Public Health. So over at Franklin County, we're, like Elizabeth said, we are doing very similar work. For us, for policies, we've passed smoke-free policies with 71 different apartment complexes. And we've been part of the passage and supporting our localities with 5 different outdoor public space tobacco-free policies. And I also want to mention, in addition to the work we've done, we've had some of the cities within Franklin County take the initiative on their own. So I think total, we're looking about 12 of our cities, townships, and jurisdictions that have moved in a direction of going tobacco-free in their outdoor spaces.
And I will say that we also passed an ordinance in 2016, which gave Columbus Public Health the authority to regulate tobacco retailers. So we do licensing and we enforce civil fines for organizations that are selling tobacco products. And that's after the Tobacco 21 law was passed across the entire state of Ohio and then later across the United States. So we have a team of dedicated professionals here at Columbus Public Health who are going out and enforcing Tobacco 21 and making sure that our tobacco retailer licensing is happening to prevent youth from being able to purchase tobacco products under the age of 21.
Yeah, that's awesome. It's so great that that's now like moving towards a nationwide policy. So if you don't have anything else to add, just moving into kind of the discussion of tobacco use on other sectors of public health, such as infant mortality. Someone wants to talk a little bit about that.
Well, awesome. I'd love to be able to. One, I just want to give kudos to Columbus Public Health and Franklin County for continuing this amazing work. It is not easy work, but it's definitely necessary and needed, especially as it comes to smoking during pregnancy and what it caught and the negative implications it can have for not just mom, but also baby. So mothers who smoke are more than likely to deliver early, and preterm delivery is a leading cause of infant mortality, disability, and diseases amongst newborns. One in every 5 babies born to mothers who smoke during pregnancy has a low birth weight, and mothers who are exposed to secondhand smoke while pregnant are more than likely to have a lower birth weight. Babies born too small or too early are not as healthy, obviously, and it increases their likelihood of getting sick, and also the worst is obviously SIDS as well.
Can you talk about like the dangers of third-hand smoke?
Absolutely. Third-hand smoke is one of those things that is not frequently mentioned all the time. I know back when I was at Columbus Public Health, it was one of those messages we were really, really trying to drive in. But third-hand smoke is the sticky residue, the yellow substance that sticks to your walls, to your clothes. If you've ever been to someone's house who was years spent of smoking or less, you can see a lot where if they would remove a picture off of their wall and you see how it just left a mark around there. That is the third-hand smoke is what sticks to the clothes. In addition to walls and other things. So when they go and you say, people be like, oh, I don't smoke in my house, I go outside. But if you come back in and you pick up that baby and place that baby on that same shirt, blouse, jacket that you were just smoking on, now that baby is breathing in those toxins. So the importance about educating about third-hand smoke is you need to wash your hands. You need to wear, maybe it's just a designated smoking jacket that you take off when you put on when you're smoking, and then you take it off and put it somewhere that is very far away from the baby. Most oftentimes they think if they're smoking in a separate room, obviously we know that that's how it travels, but also those toxins, if you're smoking on a couch and then you lay that baby down, that baby is breathing in those toxins still. So third hand is definitely one of those tricky pieces that we don't want to leave out when we talk about infant mortality, because it is one of those driving factors that can cause asthma attacks in children, and causes them to have maybe pneumonia or bronchitis and those different things that can make it challenging for the baby to breathe.
Those are some like really great pointers and information that be super helpful for some moms in the community to know about. So thank you for that. It's really helpful.
Not a problem.
And then going to like the Tobacco Free Collaborative, how is your organization working to decrease infant mortality rates?
Yeah, so the TFC, actually building off of what Amber just said, we are trying to reduce some of that household smoking exposure. So some of the things that we've done are enhancing smoking screening. So we have a program here at Columbus Public Health called Baby and Me Tobacco Free, and they will actually provide free diapers for an entire year for someone who quits smoking while they're using their program. So they would go in every month and they would get a test. It's like a little mouth test, strip test, where they determine whether or not they've been using tobacco. If they haven't been using tobacco, they get free diapers that entire month. So if you've ever had to buy diapers before, they're not cheap, and being able to have free diapers for an entire year can save a lot of money for individuals, not to mention the money they would be saving from not buying tobacco products. So that's one of the strategies we use, trying to get people to stop smoking, to quit tobacco use. And like Amber was saying, if you're going to smoke, go outside. We educate people about that. Go outside, away from the windows, away from the doors, away from the ventilation systems, and just educating people about what options they have. So sometimes that comes from our Celebrate One community health workers. They provide information about hookah use, about vaping, and they have received our 5 A's training. So that would be ask, advise, assess, assist, and arrange cessation services to help people quit. And they help support tobacco cessation early in pregnancy. So with the TFC, we are trying to encourage all of those things in combination with things like secondhand smoke prevention policies, with media campaigns, all sorts of things. So it's really a comprehensive response to the whole issue.
If I could add, additionally, with the TFC and with the Baby and Me Tobacco Free, the unique piece is that they don't just target just mom. So if dad, grandmother, whoever that mom lives with is a smoker, they can get free cessation services and diapers for the baby as well. So, you know, it takes a village most oftentimes, especially now, a lot of our young moms are living with a grandmother or a parent, and having that entire support for keeping mom's environment healthy is so critical for her, and then when the baby comes as well. So, and it's also a free resource for them if they're able to get that free service, and just because they're connected to mom. So I definitely value that. Our community health workers are boots to the ground, as I mentioned before. So really, really value the training that we received from the TFC members about the 5 A's, so that we are empowered in how do we communicate this to the community. The pandemic did not help in terms of reducing the number of individuals who are smoking currently. So therefore, we have to actively engage, because it's not just cigarette smoke that we're encountering with our pregnant moms. So we're asking about the hookah, we're asking about if you're vaping and if you're using other substances inside of there. So having that partnership with the TFC is critical to our success in ensuring that our community health workers are empowered with the right words, knowledge, and resources to make sure that all of our families are thriving in this space.
Thank you so much for that. I'd be really interested if SmileChild could help kind of tell more people in the community about that program. We could put it on like our social media or something like that. That would be awesome. And
That'd
then,
be fantastic.
yeah,
Yes, please.
yeah, if you have any like infographics or like a specific link that they can go to, if you want to send that over to us later, we could try to put that on our Instagram.
I will.
Thank you. So next, if we could just talk about how the TFC works together with Celebrate One and that partnership a little bit.
So Amber left the health department and went to Celebrate One and couldn't escape from us. So we work a lot together. We have a couple of different strategies that we work on together, and when it comes to reducing infant mortality. And the primary one is strategy number 6, which is reducing maternal and household smoking. And we do this by having Celebrate One representation at our meetings and with our community health workers. We have upstream and downstream interventions that we're utilizing. So that could be trying to get people to quit smoking after they've already started, and then at the very beginning, preventing people from smoking. So looking at it from a whole comprehensive spectrum of how we're responding. And there are also Celebrate One community health workers who provide referrals to Baby and Me Tobacco Free, like we mentioned before. So they're really empowering those participants to make those quit attempts. And then the TFC is assisting with policies for population-based sustainable change. So it's not just the individuals, but also populations. It's not just Amber and Elizabeth and Heather, it's the entire city of Columbus, and looking at behavior change for that broad population. So we try to focus on how can we make a media campaign that'll encourage people to quit smoking? How can we denormalize smoking within our community? What is it that we need to do? And how can we do that as a collaborative of different agencies who are all represented both at the Celebrate One lead entity meetings, at our TFC meetings, and where all of those different goals and objectives that we have are intertwined within the Celebrate One strategic plan. So we try to work together very comprehensively. We have some of the same goals, we have some of the same indicators, and we are reporting out every single month on what our progress is.
Yeah, that's great. It's great that you have that partnership in place, like especially since your goals are a little bit similar. And then can you talk a little bit about like the Celebrate One peer educator curriculum, the idea of like youth initiation and its long-term ties to infant health?
Absolutely. So just sprinkle on what Liz just mentioned previously, that work that they're doing about marketing towards youth, and we've seen obviously a rise in our e-cigarettes and all of those things. So we are through our peer educator curriculum, we are in the schools. So we just concluded in June, we had a cohort of it was a peer-to-peer educator curriculum. So it was teens being empowered and trained on how do you talk about, not just about, it's about safe sex, it's about self-identity, healthy relationships, but there was a component that was strong within this curriculum was about health in general. And one of that pieces, obviously, if you plan to be pregnant in your future, what you do with your body now matters. So educating our youth about being healthy, being able to make healthy choices, healthy relationship choices, that helps to increase your outcomes when you do get older, and hopefully much, much older, pushing that the kids practice abstinence until the time is right, but making sure that you're taking care of yourself mentally, emotionally, and physically to be ready to actually hold a child in your womb. And then once that baby comes, just making sure you're healthy before, during, and after pregnancy. So the peer educator curriculum piece really emphasizes the importance about a healthy lifestyle, and then also informing the kids about these electronic cigarettes. And some think, oh, it's just vape, it's just steam, it doesn't have any nicotine, or it doesn't have anything that will harm me in it. In fact, it does. In fact, it's like smoking like a couple 100 cigarettes at one time. So educating them earlier on, because we know the media, we know that TV and brands influence a great amount. So if you are going into a corner store and it has all of these fun flavors in there, you're thinking, oh, it's okay, it's just bubble gum, it's cupcake, it's green apple. But our curriculum and our staff are really, really empowering our youth about the dangers of it. And so that they are empowered with enough information to say no, and then also to be able to educate their peers. We know that peer-to-peer influence is much stronger oftentimes than it is from adults to children. So we really, really, really leverage that partnership with our schools. So we are now, I think in June, we were at about 11 to 19 schools that we were able to sprinkle some of this education in. And I say sprinkle because COVID didn't make it easy to be able to have these type of curriculums inside of the school. So therefore, it wasn't to the full magnitude that we wanted to, but we were still able to really, really reach the kids about how to take care of your body before, during, and after pregnancy.
That's great. I love the idea of like that positive peer pressure. Like maybe once some of the kids learn about the negative effects, they can see their friend who's using cigarettes, be like, hey, don't do that. That's really bad for you. Because obviously, like as you said, the peer-to-peer is so strong. You want to make sure it's like the right direction. It's awesome. Okay, I know we talked about this a little bit already, but what are some of the effects of tobacco use on public health?
So I think something, we all know tobacco is not healthy, right? We know tobacco use isn't good, but I think that something we haven't mentioned yet is tobacco use is still the leading cause of preventable disease and death in the United States. Every year, 500,000 Americans die prematurely from smoking or exposure to secondhand smoke, and another 16 million live with some sort of illness related to smoking. So, and then, the thing is with tobacco, it's a cycle of addiction. It can start at birth or even conception, and it persists throughout the life. So, more than 126 million Americans, non-smoking Americans, actually are exposed to secondhand smoke in the United States. We know, smoking or exposure to secondhand smoke can cause diseases. It also can complicate illnesses. So, and there's a lot of money spent every year combating those illnesses.
Yeah, it's unfortunate. Yeah, I mean, I guess people have known for a long time how dangerous tobacco use is since the 70s, but people continue to use it, which is sad. Talking again about TFC, do you have any like specific metrics affected by TFC yet?
Yeah, absolutely. And we do monitor the Ohio Tobacco Quit line. And Heather, I think you have the most recent updated numbers for the quit line.
Yeah, so I just pulled these today. So for last year, between in Franklin County, so including Columbus and Worthington, the entire county, we had 650 people call to utilize the quit line services. And so far this year, so since July 1st of this year through the end of August, there have been 102 residents that have called the quit line for services.
Yeah, so our quit line is 100% free for any person living in the state of Ohio, and they do not have to have insurance to be able to use it. They can get free lozenges, they can get free patches, they can get free gum for 8 weeks to be able to start that quit process. So we encourage anybody, if you are trying to quit, call the Ohio Tobacco Quit Line, get those free resources. You can, one thing I like to tell people about is you can call that person when you're being triggered. So let's say that every time I drive by a certain gas station, that's the place I always bought my tobacco products. I'm trying to quit, but seeing it as a trigger for me. You can call the Tobacco Quit Line and say, just walk me through this. I need to get home. Walk me through this. Get me there. And they'll talk to you. It's a person who is there on the other end of the line who is completely non-judgmental and can help get you there. So there are a number of different in-person services here within the city of Columbus. We are working on an integrated map where you can just go to our website and see a specific Google map that says every location of a cessation provider in the city. And you can click on your area and you can see exactly where the cessation providers are around you. So please check that out. There are services for you. If you prefer to be in person, they're there. If you prefer to do the phone line where you can just call someone to help you through it, or if you want to do a combination of everything, there are people and there are resources here who can help you. And that is something that the TFC is very much dedicated in, and we report out on almost every phone call that we have. So we are definitely trying to monitor the reach of the quit line, and we're also monitoring the reach of the campaigns that I mentioned before. So Franklin County has been doing their own campaigns, and Columbus Public Health has been doing their own campaigns. So to date, around 1,000 people have clicked our ads. So those are people who not only saw them while they were scrolling through, but they said, oh, what is this? I need some more information. So more than 1,000 people have gotten information about their cessation options or just about our other programs. And other social media users have viewed our ads hundreds of thousands of times. So we report out on those statistics during our meetings, and we try to increase that reach as much as possible through the TFC and all of our partner networks.
That's great. Those are really large numbers. You're impacting a lot of people's lives. That's awesome to hear. And how has the community responded to these initiatives? And I know that the pandemic's been going on, so how has that kind of changed or impacted your mission?
So our mission for the TFC and Celebrate One has not changed. But obviously our outreach approach has changed, and providing that we had to do virtual meetings for a lot of our community stakeholders, utilizing social media for outreach, but we had to be more creative in how we were serving. So that looked different. So we had the opportunity, I will say one of the good things about the pandemic, which was not very many, but one of the things that we appreciate is how it pushed us out of our comfort zone to be creative in how we serve. Our families still need us. There's a great need that was present, and we needed to make sure that they knew that we were still serving. So like I mentioned, social media, but one of the creative things is we started using yard signs. And it's funny because we got a little pushback from some of the community members, like, this is a government agency. Why are you guys using yard signs? But we had to think outside of the box at the time. There was a lot of elections going on. So it was working for those for voting purposes. We were like, we can increase our presence. So we used yard signs. We did drive-through first birthday and baby shower events. So instead of actually being live and in person, and drove through the cars, and we were still able to put resources in their trunks and make sure that we had our PPE on, but still serving the families and making sure that we were able to reach and meet their needs. And we followed back up with each of them that came through registration slips. We did resource pop-ups, which the team created actually, is Present on Purpose, which was popping up in places where we knew families were already going. So when they were going to the grocery store, we were in the parking lot engaging, pop-up with a table, bags with resources, and still serving. If it was fast food, we knew our pregnant moms still were going to eat. So we were anywhere that they would go. We went to food trucks. We partnered with food trucks where we were able to serve, where the community was coming up, because we're not just talking just pregnant moms. We're talking about parenting moms. We're trying to connect with grandparents who were referring us to their grandchildren. So we would be at the corner store. We created partnerships with a lot of our corner stores to be referral agents for us. So if they see somebody pregnant, or maybe, especially in our communities with the food deserts, our corner stores are the staple for that community. So if they knew someone that was coming in, like, hey, you got to call Celebrate One to get help. And they were amazing during our time. And then, even if we weren't able to remove smoking information from their counters, we could definitely get that information to them. We put it on our flyers. Do you want assistance with quit smoking? So our flyers were posted inside of corner stores as well. And that same question was put on our yard signs. If you want assistance with quit smoking, we can get you connected. So we really, really, really had to be creative and innovative, and we kind of stuck with it. The mayor actually got wind of what we've done, and if we wanted to let it go, we couldn't at this point. Even when we're out of a pandemic, we'll still have to serve in this way, because it's been has been widely received throughout our leadership and our community. So we had to be creative, but we're still definitely serving.
That's wonderful. Thank you for sharing that with all of us.
No problem.
And as we're drawing to the end of this panel, do you have any messages for the public? Since this will be going on our YouTube and our Instagram, and anything else you wanted to talk about that I may have skipped over or you didn't get a chance to talk about?
I think the best thing that you can do is help us to spread the word that not just for themselves, but for the unborn community, that we need them to quit smoking and that we are here to assist them. They can call 1-800-QUIT-NOW to get that assistance. And if they're interested in getting connected to a community health worker, they could also go to the Celebrate One website and they can refer themselves. We have an external referral link that we would love to be able to share, that they can get connected to just not just smoking resources, but if they need help with mental health support, if they need help with getting diapers, if they need a pack and play, if they need to get to a doctor, if they're having transportation issues, we want to ensure that they still get all of their needs met as much as possible. If they are pregnant and they are in the house of an unborn, and not just in the unborn, but also an infant, we want to get you the Baby and Me tobacco free. It is an amazing resource. They have an amazing quit rate in terms of how they've been able to provide cessation services. So please, please, please reach out to us and we'll make sure that you get connected.
Can I just also take a second to add on, we talk about the Ohio Tobacco Quit line for folks 18 and older, but for folks 18 and younger, there's also My Life, My Quit. It's virtual and it can be accessed by going to mylifemyquit.com.
And if I could sprinkle just a little to that as well, that we are Franklin County wide. We work closely with Franklin County Public Health and ensuring that all pregnant and parenting, so it's no longer just that we're in certain zip codes. We are now throughout Franklin County. And we, like I said, we partner closely with Franklin County to make sure that all of our moms and family members get connected and served.
And I'll say one last thing, that if you are a tobacco user and you've tried to quit, however many times you've tried to quit before, maybe it wasn't successful then, but I encourage you, please try again. Every quit attempt counts. Every time you try, you get one step closer. So maybe this will be the time that it works, or maybe it won't, but we are here for you. No judgment. You can do it one step at a time. Please make the attempt. It's worth it to save your own life, and it's worth it to save the lives of the people around you. And thank you in advance on behalf of those people for trying.
Thank you so much for that. And thank you for taking the time to meet with me today and communicate with our local community about these issues. Thank you.